first time I heard of Dr. Quiroga was when I was working at UCLA's Center for Health Enhancement, and he was hired as a new cardiologist, and someone there told me that Dr. Quiroga had worked with Allende and had been in the inner circle. Having been somebody who was fascinated by Allende's ascent to power and his plans for his country, I was very excited. I wanted to go visit and see what Chile was going to be like. And when I first met Dr. Quiroga, the very first day, I went into this office that he was sitting in and said, "Please tell me everything you can about Allende." And what he recounted was the story of the time he spent in the palace when the palace was bombed. I knew then that he was not just a physician, a policymaker, but he was a personal friend. There were a gathering of people that had supported Allende and had helped with policy, and they knew basically that the dream was over. And they knew their lives were all in jeopardy. And they chose not to leave Allende. And I asked him at the time, "But you had children, didn't you, at home?" And he said that indeed he did. And I said, "What would make someone stay?" And this is a question you could ask of torture victims. Why would they keep on after they've been slugged? Why would they stand up and resist again, or hold that banner up even higher? Why do they do that? And he said he knew he had to stand by this man that he had such respect for. And he just did what he thought was the right thing to do. Then when he recounted being taken from the palace and being on a bus and wondering if he would indeed be killed. And I think that was the fate of some of the people who he was with in the last hours. When he survived, I think he felt a sense of responsibility to perpetuate the dream and to make good the work that people had sacrificed so much for.
For me to do this work is very important because I'm itself a refugee from Chile. And I'm itself a survivor of an episode where most of the people was killed.
It wasn't until 15, 20 years later that I found out about the Quiroga that the rest of you are honoring tonight. By that time I had become a physician and I was working at Clinica Oscar Romero, and the psychologist had invited me to come to a tea in the afternoon where I would learn about this program for torture victims. And I thought I was just going to write a check and meet and support these lovely people who did this good work. I had no idea that when I walked into that room I would run again into my old friend Dr. Quiroga, who said, "Kendra, remember how I helped you all those years ago? It's time for you to help me." And I said, "What are you doing?" He said, "Well, I am an expert witness for torture victims, and I examine the patients, and I go to court, and I can describe to the judge and verify that these wounds are the result of torture, and sometimes we can get them asylum. And there's too many of them for me to do this alone." And I said, "Do you have a grant?" And he said, "Not yet." And I said, "Will anyone else do this with you?" And he said, "No." And I said, "Will I have nightmares?" And he said, "Most likely." And I said, "I'm your gal." So I joined his effort after he trained me for several months, and I had to watch these pictures of people being tortured and hear stories of how torture was done. He had taught me how to recognize things like cigarette burns and heel prints on people's bodies. But when I saw those things, it was devastating.
You had to analyze first the trauma history. You had to go later to asking about the different methods of torture that you have been really applying to the victim, and later you have to go to do a physical examination, a complete physical examination, and you have to do, in addition, a forensic evaluation of the lesion that the person has.
As people started coming to him for treatment of torture, he came to us and asked for space. He came to Venice Family Clinic and asked if he could have a few rooms, and we said, sure. This made sense to us that people needed the care and that he could offer care that we couldn't. What I recall with Dr. Quiroga was when he went from offering the victims of torture clinic at Venice Family Clinic to all of a sudden being asked by both the United States and the UN to apply for dollars so he could begin to train people internationally in how to help people who had experienced torture.
You know, what was amazing to me about the program for torture victims is that it moved to a wider realm, and it became international, and truly was all about human rights.
Dr. Koga is very aware that while the United States may be a place of sanctuary for many of the victims of torture that he treats, it is also sometimes the torturer in the country that they came from. I mean, the sad part about what's gone on with this country is that there have been physicians who've inflicted torture over the last few years. The role of a physician is to heal, is to care. They take an oath to first do no harm. Dr. Quiroga exemplifies this. However, many of the people he sees have experienced the role of a physician as that of someone who's intentionally inflicting pain. Dr. Quiroga is unique in that he can gain a person's trust fairly quickly when parts of their body may be touched by him that in the past were touched by a physician or another person who was inflicting pain. And that takes a huge leap of faith, but it tells you what an exceptional person he is. And I realize that he's seeking justice for many people, and it may be in a one-by-one way, but overall, that leads us to a society that insists on not just sweeping things under the rug, so that we seek justice for others and trying to make something horrible not continue.
But there was something else he told me. When he tried to convince me at the T many years later that I should come and help him, even though I had now small children of my own, a very busy work schedule, he said, this is why I think you should do this. He said, you know, I'm a cardiologist. I get great satisfaction from restoring people's health. They may be able to walk without pain, join their family's activities, not be frightened that each breath is their last. But he said, you don't know what it's like to work with a torture victim who doesn't have their soul anymore. Because it's one thing to feel like your heart and your body have abandoned you. It's another thing to feel like humanity has abandoned you. And if you work with torture victims, you may give them back something more important than heart and health. You give them back their soul.